So I take it you're introducing him to patients, right?
Yes. Yes.
Okay. So what he needs to know is to not open he needs to know where to stand in the room.
Okay.
He cannot stand in the room where he's blocking the patient between leaving. So the best place for him to stand is at the head of the table.
Okay.
And then you would typically, when you're done with the patient, you typically lead him out of the room, don't you?
Yeah.
Okay. So if he stands at the end of the table, then he won't be blocking him.
Correct.
Okay.
Correct.
And then also he needs to be aware of open-ended questions.
Yeah.
So are you familiar with open-ended questions?
Yeah.
Okay. Well, what we don't want to do, like what it should sound like is Dr. So-and-so's on working with us now. He's one of our oncoming doctors. And then don't say he's a recent grad or anything like that. Just he's one of the oncoming doctors. And then it should go to the focus should go to clinical fast. It should get away from him
Yes. Yes.
fast.
You go to clinical.
What he should know is if the patient says anything to him, answer it and don't ask an open-ended question and don't keep talking. And whatever you do, they don't want to hear about you.
Right.
Don't you talk about yourself in that room. They don't want to hear about you. They're here for them, not you.
Mhm.
But that's the thing that I don't want the associate doctor to ask I don't want him talking about himself. I mean, if he says, yeah, if they ask him, where'd you go to school or whatever, answer. But
Of course.
I want to answer and shut it down, and that's it. I don't want to keep talking in that direction. They're not here for you. Just like they're not here for Trevor.
Mhm.
So and then then don't keep talking about the topic, close it down. And then what you need to do is focus back to their healthcare, back to them. So
Mhm.
I would just give a real quick explanation when you see the patient. Mary's come in with back pain, and all you need to is just say a couple words clinically.
I
Uh,
always ask for permission. Is it all right if he observes? Right.
oh hell no! You don't want to ask their permission. He's fucking in the office. They pay.
Okay. 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 All
No,
right.
like they're paid for it. Don't
All
tell them
right.
no.
All right. Okay.
It's
All
like
right.
you asking, can I touch you? No, they're paying for you to examine their ass.
All right. All right. All
Oh,
right. All right.
shit. So,
All right.
no, he's an authoritative, just like you just don't want to look him like you just don't want him to look like a peon. Go, oh, he's a recent graduate. No, you don't want him to look like he's naive and dumb.
Okay. You're right. You're
We've
right.
avoided that for the most part, I believe. Some people do ask like if I graduated recently, but
Yeah. How do I handle that?
Well, if they ask you, tell them. Don't lie. I mean, if they
Okay.
ask you a question, tell them, but just don't keep going on about yourself.
right. Okay.
But yeah, don't volunteer that we're naive.
Right. Right. Okay. Okay.
I don't know what I'm doing yet.
Right. Right.
But you still have to pay full price.
Yeah. Oh, I want that.
Um, so the
Okay.
attention should real quick. I mean, it goes to him. Say, hey, doctor's our oncoming doctor, and and then it should go right back to the patient. We shouldn't be talking about him at all. It should go right back to the patient. And then what I would do is just like you're talking to him, I'd
Yeah.
go, well, Mary Hare's been having lower back pain. And then whatever her diagnosis is, she's got facet problem. And so we're working on her facet problems. That's what I'd be saying to him. So the patient sees that he sees what's going on. And your
Perfect.
topic is back on them.
Yeah. It's
So,
good.
like, if the patient came in the room, it'd be like this. We were in the room. I saw, hey, Mary, how's your day going today? Mary says, all right, Mary, let me have you stand here, sit here, whatever you do. Direct them.
Yep.
By the way, Mary, we this is our associate doctor with us today. He'll be with us from now on. Um, and then I go, Mary here's been having low back pain. See, I'm going right back to Mary. So Mary's having low back pain. She's having some facet arthrosis. Just one or two things that you remember about that patient's condition. Don't open the notes and don't go through a whole case evaluation. Don't do any of that. You're
Okay.
just doing, that'd be different if he was treating.
Right.
It'd be more interactive, but he's not treating. So
Mhm.
you don't have to go into any kind, and then I'm just going to go, Mary here's been having some facet arthritis. She's got some degeneration in her spine. And so that's what we're working on. That's it. And then if you want to explain what you're treating while you're doing, like kind of doing a talk tell treatment, like
Mhm.
you're talking as you're doing it, tell him what you're doing. Patients
Mhm.
like that.
Right.
So what we're doing is we're working on, whatever it is, how you use your language with your treatment. Like it was me. So we're going to adjust, the L5 vertebra. We're going to pay
Mhm.
attention to the right SI joint. So
Okay.
that's what we're going to pay attention. See, that's what I'd be saying to him in front of the patient.
Mhm.
And then see, you just keep moving on.
Mhm.
As soon as you said, he'll be with us, it's over. Now it's back to the patient.
Okay.
Okay.
Okay, that's good.
And then close them down. If they do ask a question, answer it, and then go back to the patient. Mary, like talking to him, Mary here's having low back pain. We're working on blah, 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 blah. Okay. And then, so make sure he knows, the steps of getting in and out of a room,
Mhm.
the pro action words. So what are the steps? How are we doing today, Mary?
Mhm.
Don't chase them. All right, let's get started, Mary. Number 2, let's get started, Mary. Scale of 0 to 10. Where are you today? All right, let's take a look at you, Mary. Sit here, stand here. That's number 3. These are all action words to get the patient to move.
Mhm.
All right, sit here, stand here. Okay, so you go ahead and do your E&M, your palpation tenderness.
Mhm.
So you're going to do palpation tenderness, muscle spasms. Say it out loud too. You see fixation, remember it's good to say it out loud. Whatever your tenderness here, Mary, tenderness. So it's tender right here. Say grade 2 tenderness, L5. We have a little bit of a fixation, L5, S1. And then we have bilateral erector muscle spasms, more mild. See, that's what it would sound like.
Mhm.
Patients like to hear that because it's about them. All right, and then the next action. Okay, let's go ahead and treat you, Mary. That's the next action step. These are all action phrases.
Mhm.
Go ahead and treat them. When you treat them, what do you always say when you're done? You tell them you're done. All right, that'll do it for today, Mary. And typically what should happen is, hey, Mary, hold 1 second. Let me make sure I get this in your notes. Then that's typically when we turn to the notes and write in the SOAP notes. Remember, SOAP notes is just 0 to 10. And then you're just going to put in the objective, fixation, whether you're going to check for 3 E&Ms. Was there a fixation? Just list the motor unit and then grade it 0, 1, 2, 3. Functional capacity, tenderness, put the motor unit, grade it, and
Not go when your son's band is playing in the parade. So
muscle spasms. Unilateral, bilateral. Remember, you just do regions, lumbar, extensors, unilateral, bilateral, and then grade it, mild, moderate, or severe. That should take less than 12 seconds.
Mhm.
Remember, if the patient starts talking, now if they start talking to him, that's fine. You just keep doing what you're doing.
Okay.
But remember, if the patient starts stopping, you don't stop and then follow the patient. You stop the patient. Okay. Remember, hold just 1 second, Mary. Let me make sure I get this for your records first.
Mhm.
That's how you control it. Get it in your records. Then you would turn back to the patient and go, what was that again, Mary? And then, all right, that'll do it. We'll see you Friday, whenever their next schedule is. We'll see you Friday, see you Monday, whatever. Let's head on over to therapy. And as you do that, as you say it, you should be visually walking out of the room. You should be turning away, your body language, you should be walking out of the room. Usually you got to walk out of the room first.
What happened to you?
If you don't, then they'll just keep you there.
They'll trap you there. Yeah.
Your thing, you need to be. You keep your.
Okay, so that's the basics of moving them through where he needs to be, what you need to be saying and paying attention to, or he will slow your ass down dramatically. Imagine you got to take an extra 3 to 4 minutes per patient and you're seeing 40 patients. He's just slowing this damn thing down. It's not him personally.
No.
It's anybody that would be there that this would happen. So you got to control the hell out of this. This can really slow you down. The more patients you see, the more this can slow you down.
Mhm.